My name is Safia. I am 40 years old and I currently reside just outside of Milwaukee, Wisconsin. So I have a beautiful, healthy young boy. He's 5 years old. I went to go interview, and that's very deliberate. I went and interviewed multiple surgeons. I wanted to feel comfortable. I wanted them to understand what my goal was. I wanted to make sure that I was being heard and understood, and more so, valued and respected. I didn't want to go in feeling like they were just gonna reconstruct and I was just another patient under a knife. So with that, when I did, I sat down and my physician really went through. I mean, she drew out all the different options. She explained to me the different fittings, the different profiles, the looks. From there, we went into the reconstruction, the first phase, and that was included the bilateral mastectomy that I had as well. It was very important. You hear a lot of the horror stories, unfortunately, with picking out surgeons who are not board certified, and I was very deliberate in making sure that my surgeon was board certified. I wanted to feel more of my own and in my own body. I was really lucky in being able to go to my surgeon and show her a photo of me when I was breastfeeding, and it was the look that I was trying to attain. I just felt that it was already there. It was what fit to my proportions and my body. So it seemed just very casual to pick that specific size and shape. And she understood that. She was very receptive to the goal and the look that I was going for. And my surgeon was spectacular. She really helped me to understand all of my options and understood that it was really important for me, again, to be able to take agency over my own body and make the decision of what it is that I wanted and the look that I wanted specifically. I was very pleased with how she went through the entire list of care prior to the surgery, during the surgery, what would happen, after the surgery, my recovery period, 6 to 8 weeks, what I was and was not allowed to do, even so much as to helping assist me with how to prepare my home, how to make things more comfortable for me. She gave me checklists and helped me with understanding, what would feel comfortable, what might not feel comfortable. She was very detail oriented also with regards to post-surgery, what I would be looking like and feeling like going home. Part of my procedure that I had for my second phase was actually a fat grafting. And so even with that, looking farther into the future, she assisted in making sure that I understood what the entire journey was going to look like and not just the few steps right in front of me.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.